Hi, everyone. I am Dr. Maria Sampalis. Thank you for watching the Reframing Eye Care podcast. Today, I'm talking with Dr. Bill Reynolds. We're talking about an important topic, AOA advocacy, and why all ODs should be involved. Dr. Reynolds was past president and now advocacy chair, and it's an honor to have you on the podcast today.
Thank you, Maria. I'm happy to be here.
Yeah. AOA advocacy is very important. I always say, and I've heard this from others, I can't even take credit for this, but it is the insurance for our to practice, right? And I think it really touched base for me with this Florida license issue in Florida, and if it happened in Florida, it would have went throughout the country. So I want to thank all the doctors that were involved in that, and then also, the AOA for making that not happen. So, and your efforts as well.
Well, the doctors in Florida did a great job stepping up, and of course, AOA played an assisting role there. And you're right. These things affect doctors who practice in everywhere, and it is important that we're all involved because we're such a small profession. There's just about 40,000 practicing optometrists, as opposed to, if you look at physicians, it's 1.2 million or somewhere around in there. The numbers go up and down a little bit. But, if we don't have good involvement across the board, we don't have enough, critical mass to be effective legislatively.
That's correct. So give us some more information on the physician, title legislation, and because I think that also went to other states as well, but the big stop was in Florida.
There are several states, and we have been able to stop it in every state, and also there is some federal legislation, and basically it is legislation to try to diminish the role of optometrists. The purpose of it is to make it sound like we're not real doctors, and to diminish our role both in the legislature and among our patients. And it is a response to our success in scope practices. We've advanced scope across the country, and we have 10 states with advanced procedures now. And this is kind of a response to try to fight back on that.
Now, if that did go through, though, that would have, the doctors commented on all different Facebook groups, but that would affect like insurance reimbursements, a lot of other things. I guess they couldn't it'd be like illegal in certain states. Like, what would be like the big repercussion if that actually went through?
Well, it's different in every state. They were all a little bit different. Some of them, you could not call yourself a physician. Others, you could not call yourself doctors. And so it could play a role as far as reimbursement. Certainly when we look at Medicare, we're defined as physicians in Medicare. If you're not allowed to call yourself a physician, would it affect that? Would it affect your reimbursement there? I think there's a lot of questions out there, what all it would have done. But certainly it would have lowered the image of the profession. And that was the purpose of it.
Of course, yeah, that was the thing. And I think that hit a lot of doctors. I think a lot of doctors came together to help Florida. And I think that was one of the great things that all the doctors came together to make sure that this didn't go through. So that was a big win for optometry as a whole. So that was great. And it just shows the importance of doctors wanting to join the AOA and help with advocacy and be involved.
Shows the power of things we can do when we all work together.
That's correct. The other thing that I think that's important is the upcoming FTC ruling. Can you give us a little bit of insight on that and how does that impact us?
Yeah, the FTC, of course, a few years ago came out with a ruling where you had to have a signed acknowledgement of giving out a contact lens prescription. And right now they're in the rulemaking process of doing the same thing with a spectacle prescription. And of course, you have to and you should be giving out a spectacle prescription just like a contact lens prescription to every patient. But now they're setting up the process where you're going to have documentation that you did that and the patient signed that you did that, and make it more burdensome, more paperwork for offices, more paperwork for patients. And this is kind of a answer in search of a problem. I don't think that this is a tremendous issue. It has not been for years. But the FDA is moving forward with that. And yeah, I don't think there's really a whole lot that is going to change their mind on their position there. And so, our role right now is to try to make it as less burdensome for practices as possible and to make it as efficient as we can. But we do expect this ruling to be out within 6 months. And one of the things that they did not include in it that was kind of discussed on whether to make it a mandatory that you do a PD, and that is not in this rule.
Okay. Can you give us some insight on, stagnant vision plans, reimbursements? I mean, a lot of doctors, it affects everyone, right? Private practice, corporate practice, and I think more in corporate practice because those doctors are heavy vision plans. Give us some insight on that, and what is the AOA doing from that stance?
AOA has a multi-pronged approach to this, and this has been a priority. When I was president, before COVID hit, it was a priority. COVID kind of changed the world a little bit, and then certainly with Dr. Lehman and Dr. Benner, I mean, this has been a priority for us, and we've done any number of things. Reimbursements for exams are not a whole lot different than what they were when I started, and that's been a year or two ago, as you can see. And they're extremely undervalued, and it's a problem. And some of the vision plans will acknowledge that they're under reimbursed, and some will not. So we've done everything from meet with the plans to try to work with them. We've looked at perhaps legal remedies. We've looked at legislative remedies. We've looked at any number of possible avenues to go after this. We've worked on it with federal legislation. We've worked on it on several state legislations. We've worked in coordination with the American Dental Association because they're in the same boat with dental plans. They've got a lot of abusive policies that are similar to what we're facing. And this is one thing that certainly being in a coalition, I think will benefit us quite a bit. And this is a huge priority for AOA, legislatively, advocacy. We're going after this with everything we got, and we don't have that magic bullet. We've looked for it. It's not there, but we're going to fight it on every angle that we can, and we're going to keep fighting it until we get fair and just reimbursements for our services.
The other thing that's been a hot topic for a lot of doctors has been remote eye exams. Can you touch on what AOA is doing with that and setting guidelines and helping that, continue, the doctor-patient relationship?
Well, that is something that is coming, and technology for remote eye exams is improving all the time. It is going to become more and more. I do think in the corporate world, ODs there might be at more of a risk of losing their position than in a private world. We can't be against technology. We can't be against doing things. But what we can do is we can insist that the standard of care stays the same every place that you go. That the remote exams have to equal an in-person exam. It can't be just a acuity screening like some of them are trying to do. It can't be just a refractive. There has to be an eye health component to it. And the standard of care remotely has to be the same as what it is in person. We have a telehealth council or a telehealth policy. We work with telehealth providers, people who are involved in developing standard of care and things like that, to try to come out with policies that ensure that there's good patient care, and that when we move forward with this, as I'm sure it will, that we'll do it in a correct and a safe way for our patients.
Yeah. You did say that, you think that the remote eye exams might affect corporate optometrists a lot more. Can you give us some insight of why you think a lot more corporate optometrists should join the AOA? And I think AOA is, wants more doctors. To be able to give them more insight on what affects them in their practice. If they're not members, it's hard for them to get information from them, correct? And I've tried to, get doctors to join or just report abuses that are going on in these practices. But tell us why you feel that, a lot more ODs should be joining the AOA.
When I joined the AOA a long, long time ago, there was a stigma about corporate optometry. And that's not true. And actually, it's not been true for a long time. We're all practitioners. We all serve our patients. We all work to make the profession better, to make our care better. And that can be done in any number of settings. And there's a lot of things that AOA works very hard for corporate optometrists, and remote eye exams is for one, or reimbursements for one. When we work with the FTC, that's going to benefit them. There's a lot of things that if you're not involved, you don't know about. And if you don't know about it, you can't do anything to make it better, and you can't do anything to protect yourself either.
No, that's important. And I think now there's a lot more opportunities for doctors to join as members. And if they want to be involved, there's ways to be involved and be mentored and be more involved with the AOA, I think, with committees and things like that. So if doctors are listening and they want to be involved and they want more of a leadership role, and there are ways to get there with the leadership committee or the institute that they've done, I think it's important that people get involved.
AOA has over 300 committee members right now. We're very active. We have more than what we've ever had, and it's rapidly expanding year to year. And the states are the same way. The states need and want you. They want you not only to be members, they want you to be active members. They want to know what your needs are, how they can come in and help whatever style of practice you're in, how they can come in and make that better.
That's correct. And like you said before, they're actively fighting for our profession that helps everybody. But it's also not, like you said, one magic bullet that will help with a lot of this legislation stuff. But maybe it's a different insight on how to tackle a problem. And the new individual might have that, right? So it's good to bring on new ideas and again, all doctors are welcome to join. I'm on a committee, I'm involved. And I think doctors should be involved, and even at a young age too, just to see what goes on first, because it affects the younger doctors a lot more for their future than the older doctors, right? So
you're right. It's your future. It's your profession. It's your livelihood. You need to be involved. And again, we're small enough where we want everybody involved, and we need everyone involved.
Well, I want to thank you so much for coming on the podcast and sharing the insights of what the AOA is doing. And thank you so much for your time.
Thank you, Maria. I appreciate you having me on.